So my name is Dr. Laurence Maiden, and I'm a consultant gastroenterologist. And in my NHS tenure, I'm also Chief of Medicine and Emergency Care. So why did I decide to become a doctor? I was very young when I decided. I was about 6 years old actually, and I'm not entirely sure why. I think it might have been because my mother was a little bit ill, and I said that I wanted to take care of her, um, naively thinking that of course you could look after family members. But I think it was just that once that idea was set, it was unshakable. And I think that's something about my personality. Sometimes when I set my sights on something, it's very difficult for me to let go. So it's something I've always wanted to do, and I've always been interested in sciences as a result. And I think it was the right decision because I find it a wonderful and fulfilling career as a doctor. Why did I want to be a gastroenterologist? I think it's because it's more practical. It's not only being a physician and trying to come up with a diagnosis. It's actually also applying therapeutic tools and using all the equipment, all the endoscopes, upper GI endoscopy and colonoscopy, and all the wealth of tools that we have available in order to do something therapeutic. And actually, I find that um, very enjoyable part of the job. So the most rewarding aspect of the job, I think, is the satisfaction of seeing patients and seeing them through a journey and helping them when they're at their worst, and hopefully getting them to a place where they're at their best. So I think that satisfaction, the patient satisfaction, is rewarding. Also doing something therapeutic, being able to stop a bleeding ulcer or removing a polyp or helping with symptoms is very rewarding. Um, and that challenge of looking for a diagnosis, finding a diagnosis, and then implementing a management plan, all of which help a patient on their journey from being, as I said, sometimes at their worst to hopefully at their very best. My patients, I think, find the most valuable for me from the feedback I've been getting is my friendly and approachable my friendly and approachable manner, that they're able to confide in me and open up and often reveal things that can be quite difficult or embarrassing to talk about, and know that they can talk fully and frankly with me so that we can arrive at a diagnosis and help them in their management plan. So I think being open, friendly, and approachable would be the things I think my patients see in me most.